Yes. So from then, as I said, I wrote, what I felt was going to happen. So the ambulance came.
Do you remember what you wrote on the letter?
I don't.
Or the paper?
And I don't even know where it is.
Wow.
I don't, yeah.
Okay.
So the ambulance came. By then, I couldn't speak, So they read what I wrote, and then I think my daughter told them what was going on. So they were saying, why are you not talking? Now I know it's aphasia. It's just part of the signs and symptoms of stroke. But then, in my opinion, I was just saving my breath, every ounce of breath I have, just to stay alive, because I felt myself dying, but I just wanted to, stay alive, but not even talking, because I felt like, okay, I need this breath. To live? Yes.
You did mention a technical term just now, aphasia.
Oh, okay, sorry.
It's not an everyday... No, it's absolutely fine. Because what we are going to do is at some point we'll try and go a bit technical when we look at the condition. But I want us to set the scene with your story, get to a stage, and then we will take it from there and let people know what to look out for. So aphasia, what exactly was that?
When one has a stroke, sometimes one of the signs and symptoms is that you lose your speech. So loss of speech, you can't talk. Sometimes you find it difficult to understand what is being said to you. So the speech aspect of stroke, this is one of the
absence of speech.
Yes,
wonderful. So then the ambulance turns out. How long did it take? Did they say that your daughter tell you how long it took?
Luckily, it didn't take long. I was so lucky. I think between 5 to 10 minutes, the ambulance was there. So everything happened very fast.
Very fast.
Yeah, it happened for about 10 minutes maximum.
And do you remember where you were taken to after you were picked up?
Okay, when I couldn't walk at this time, so they took me on a stretcher into the ambulance. So inside the ambulance, this is what I remember happened. So I started having this blurred vision, having seen some flickers of lights, and then I saw as though it was raining, but it was only me that could see it. It wasn't raining. I knew it wasn't raining, but my own visual, my own sight, tells me it was raining. You understand? So in the ambulance,
and obviously you were inside an ambulance,
yes,
so you
by
weren't
then,
going to see.
Just by my house, they had still not moved. So of course they have to stabilize me because they have to do ECGs, observations, saturations, and things like that. So it took them some time before the ambulance moved. So right until this time, I do still remember.
Wow.
I remember all the way till they took me to one of my local hospitals.
Okay.
Then from there...
let's take it in stages. So you are in the ambulance now. What happened in the ambulance apart from taking your baseline observations, which temperature, pulse, respiration, blood pressure? I'll tell you, I think I was in and out of consciousness, so I can't tell you much. The only thing I remember was the blurred vision, and then in my opinion, it was raining, even though it wasn't raining. And then I remember them putting ECG leads. I had some oxygen, and that's it. Yeah. That's all you remember.
That's all I remember in the ambulance.
Wow.
Yeah.
And then what happened after that? Obviously, from this stage, a lot of it you would have been told by other people.
Yeah.
What happened next?
So what happened when we got to the hospital, one of our local hospital, I was told I had an MRI scan.
Okay.
Till today, I don't remember going into that tunnel, the scan thing. No, I don't remember. The next thing I remember was I was in a second ambulance being transported to one of these London hospitals where interventions happens. To Queen Square. Okay. So I remember in the ambulance, one of the crew started asking me, on a scale of 1 to 10, how is your pain? So by then, I was having such an excruciating headache. Yeah.
Which you never had before.
No. So I was saying 10. On the scale of 1 to 10, what is your pain? I kept saying 10. 10. So by then it was really painful. Yeah. So all the way till we got to Queen Square, there was really excruciating. Yeah.
Was there pain anywhere else?
Not that I remember. It just headache.
Just headache.
Headache, severe headache, and I know I was in and out of consciousness. I would just open my eye and would still be in the ambulance, and that's it.
Obviously, the story that is coming up after all this is what is so mind-blowing. Obviously, the initial stages of all of this is incredible, you know, but I think your experience from that stage is what just takes my breath away. What happened in the second hospital?
Yes. So in the second hospital, luckily, I had gained full consciousness. So I remember the doctor came to speak to me and told me that I've had brain hemorrhage from the MRI scan they took at the first hospital. So I've had a brain hemorrhage and also encephalitis, you know, so it's all to do with the swelling of the brain. And so that is what the doctor told me. So they started me on this medication called nimodipine. So it was given to me every 4 hours. And I was told that it's just to stop spasms of the blood vessels in the brain. So
and what more do you remember after this stage?
So after this stage, I quite remember asking the doctor, okay, so what happens now? Because being a nurse, lots of things were going through my mind. So
I can imagine.
So he said they are going to do another CT scan and an MRI scan again in their own hospital. Then they will take it from there. So I went for all the scans just to confirm, in the hospital. So I was told that I'm going to have a surgery, brain surgery. And
at that very time.
I will have it. Not immediate, but I will have it. Very soon. Being a nurse, I was thinking, oh my goodness, which type? Because I know which types, you know, there are 2 of them that can happen. So I was told that, okay, the one I'm going to have will be a catheter inserted through my groin, you know, just to go and then repair.
Into your brain.
Yes, to repair,
The story is going to be very interesting after this. So I think, like I always do on this show, I want people to get a hang of the anatomy of the brain, and then we look at, so they get a picture of what you are trying to describe. Because after this stage, it's in a very acute stage of your hospital admission, isn't it?
This is acute. We just got to King Square now.
We have just got to King Square. Viewers, if you haven't phoned your friends and your family to join in, I think you are doing them a very great disservice, like I told you. Because stroke is very common with our race as well, black ethnic minorities. We hear those words all the time these days. So please, if you haven't phoned them, just get them to join in so they can listen, because it doesn't matter whether you have any condition, any underlying condition or not, this can catch you out at any time. And you'll be lucky to have people around you to even assist you at the time, isn't it? So I think it's going to get very, very interesting at this stage. But if the producer can get us to the pictures that we have, so that we are talking about the brain. You know, I talk a lot about the heart, but tonight we are talking about the brain, and we are talking about stroke, and we will take our time to explain things. So we will come on with our first picture. And so what is this one?
Yes, so this is the anatomy of the brain. We made it very simple.
Enough.
So one thing we need to know is that stroke can happen any part of the brain. It could happen to the frontal lobe as it's labeled, parietal, occipital, cerebellar, you know, and cerebrum. Left and the right. So it could happen anywhere. In the brain, obviously, the pons especially. Also,
Obviously, this doesn't show clearly whether we are the front of the head or the back of the head, because
so
we don't actually show. So
it
is very technical. So I guess the frontal lobe is descriptive enough, like is at the front of the head, around your forehead, and then
the occiput, you know, is
also at the back
is at the back
of the head. So we are looking at the head from the front to the back. And then I think the brain stem is there. And then the rest rest of the body. So this is just a picture of the brain, just to highlight the fact that there are different parts to the brain, which will come in very handy because, like you rightly said, stroke can happen at any part in the brain. Right. There is another diagram which shows other parts of the brain as well, isn't it? So if the producer can just take us to the next diagram. And now we will be talking. So the doctor at this stage has mentioned to you that you've got a type of brain bleeding into the brain. Right. So if we can see the next picture that we have, and then we can try and see. So that is just like the brain without
in general.
In general. Again, it's a picture. I don't think it's like the the normal looks like this, isn't it? With all the.
This is the same as the other one that's already shown. That's the occiput. That's
so again, the front of the brain this way. And then the back of the brain this way. I think we'll quickly go through the diagram. So if we go on to the next picture, and again we are trying to see
the blood
how
vessels.
the blood vessels. So it is a complicated network, isn't it?
How they are interconnected.
Of the blood vessels in the brain, and I guess this is the face, isn't it?
That's it.
And then
it's the same
front of the
module, of the brain.
Front of the brain all the way to the back of the brain. Right. So at this stage you had been told that you have bled into your brain.
Yes.
Right. So in showing these pictures, which part of the brain had you bled into in your very case? Like, we know it can happen in other places, anywhere, but where did they say to you? Do you remember?
I don't remember, but now I know.
Now you know.
Yeah, I know it was the right cerebellum somewhere here. Okay. Yes, so that is where I bled into.
Right. Okay. And then now you are in the other hospital, the second hospital. So that's a very advanced hospital.
Yeah, it's called HASU. We have HASU, that is hyperacute stroke unit.
Oh, right.
Yeah, because we have acute stroke unit, but the hyperacute stroke unit, that's where the interventions happen. Right. Where if it's, so we have types of strokes. If it's ischemic stroke, then they will thrombolize you. Right. If it's hemorrhagic stroke, then, and they can do surgical interventions. That's where surgical interventions happen.
Right. We'll take
so they are specialist hospitals.
Why were you not able to be managed in the first setup, the first hospital?
In the first hospital. Yeah, they don't have the facilities.
They don't have the facilities.
Yes, there are special hospitals in London designated for surgical. Yeah, all throughout UK there are different types of surgical hospitals who do interventions.
So I think at this stage we'll move on to the next slide, and then we will start looking at so now we come to this very interesting picture here. What is going on here? Right.
So this is what I had. My stroke was a hemorrhage and was called ruptured aneurysm.
Ruptured aneurysm.
So this is an aneurysm. Right. If you can see all the vessels, they are all nice and straight, and vessels, your blood is going through nicely. But with this,
do you want to use the pen?
So this is where it's called aneurysm. So the blood vessels have now outgrown its source, so there's a bulge there, and it could be in anybody's brain. You will never know.
You will never know.
It's just there. Apparently, a lot of people have it. Nothing happens. They grow old, and you will never know.
Right.
But some people also, unfortunately, it will rupture. Yes. So that's it. So this is the type of aneurysm I had. Right. So it bled. It ruptured. So this, when it ruptures, then it goes into the subarachnoid space. Then you have what is called subarachnoid hemorrhage. Right. So that is what I have.
Which is very common, actually, isn't it?
It is common and very dangerous. One of the dangerous
Okay.
As well.
So in this type, it's just what type is it? This kind of stroke.
It's a hemorrhagic. It's a hemorrhage. Hemorrhage means blood, bleeding. Yes. So when this aneurysm ruptures, then there's blood, so that is the hemorrhage. So you hemorrhage into the space, the subarachnoid.
And that is just one type.
That is
of
one
stroke.
type of stroke.
Right. But what other type of stroke do we have, or types, if we do?
So we have two major types. So we have hemorrhagic stroke and we have ischemic stroke.
Okay.
But then again, there is TIA. That is transient ischemic attacks. That's described as mini stroke. So I always say those who have TIA, they are the lucky ones, because that one is just warning you. It's just giving you a warning that your blood vessels are getting narrower. There might be some clots or cholesterol, some plaques, lining in your vessels. Yeah. So you need to get
be on the alert.
Yes, be alert. Yeah.
You see, when I was reading for this, the brain and the way it works and its network and supply and everything reminds me of the heart.
That's right.
Because like the way you are progressing your discussion, like how the vessels get lined with build-up of plaques, and so it happens generally in all the body, the vessels, isn't it? And then the brain happens to suffer with this condition as a result of it. So can we look at the other type then? We've looked at the ischemic stroke. Right. So if we can have the other slide as well. I think this is very graphic, isn't it? Yeah. The picture that we have. So what's going on here?
All right. Can he show the other?
I think there is another slide that we need to.
That will be easier.
Is it this one?
No.
Yeah. So again, this one is the ischemic, the ischemic stroke, But you want the hemorrhagic one?
No, I want the ischemic one.
Okay.
No, go again. There's very simple one. Okay.
I think we can probably
We can use
this one too.
Okay, so with the ischemic stroke, what happens is that there's buildup of clots or plaques, like cholesterol and things like that. So they travel through your blood vessels slowly until one day it blocks one of the blood vessels. Then it depletes the brain of
its oxygen
rich oxygen supply, and then the tissues start dying.
Right.
So because that is a clot, that one is ischemic stroke.
Right.
And the other one that your aneurysm ruptures, that one is hemorrhagic stroke. Yeah. And with the TIA, the one I said is a mini stroke. Yeah. It's also clots, but then it hasn't blocked it completely yet. So it shows symptoms exactly like stroke, but then it will last for maybe few minutes or some hours, then you regain everything back. But don't, say, oh, I'm okay. Don't ignore it. It's a major sign that there's a stroke, major stroke impending.
Wow.
So see your GP, go to hospital, whatever you have to do. There are specialists, TIA nurse, you will be referred, and they'll give you medications and health education. If you have to, modify your diet, whatever, take your medication, and I'm sure you will be fine.
Yeah, I mean, obviously, because we can't have a mini stroke, which we can sort of pick up on our own, this brings us to what do we look out for? What are the signs and symptoms we have to look out for? Because otherwise, apart from obviously having a bad headache, which could be a migraine or could be anything else, what do we look out for?
When you have a stroke.
When you have a stroke, especially with the mini one, because of course the major one, it may just happen and you may not be able to seek help like you are asking us to, isn't it?
What happens it's the same.
It's the same.
The mini stroke is the same. All the signs and symptoms are the same.
Right.
The only difference is with the mini stroke, it doesn't last long. You can regain consciousness, you regain all your limb functions within minutes.
So you can't lose all these functions with the mini stroke as well?
Yeah, with the mini stroke. But then it won't keep long. An hour or 10 minutes, and you say, oh, I'm okay. But seek help.
You can collapse?
You can collapse. Okay, so signs and symptoms of stroke. We've been having advert that says fast.
Yeah.
So fast, F is for the face.
Yeah. Has
the person's face drooled? To one side, you can see the lips.
It's like a facial tilt.
Yeah, tilt to one side. That's it. Something like that. That's what is one. Then A, we talk about the limbs, arms. Can the person lift the arm and keep it there?
Keep it there.
Or the legs and keep it there. So that is the A bit. And then the S is the speech. Can the person have a good communication with you? Are they confused? Because sometimes they could be, you know me, as we are talking. But if you're asking me something and I answer you like something that is way out of, or even slurred speech, you know, they could be talking, but you know the speech is not coming properly. So if you see any of these three symptoms, then the T is time. Time to call for help. Right. When you are in this part of the world, you have advantage of calling the ambulance, isn't it? But if you are a certain part of the world where you don't have ambulance, fine. Still, make sure you take the get to the hospital as fast as you can. You know, don't delay. At all, yes. Okay. Seek help. Wow. Seek help.
Okay. So we have looked at the three main types of stroke. The transient ischemic attack, TIA for short. TIA, And then we have the ischemic attack
to do with the clots and plaques and
You know, 2 weeks ago I looked at atrial fibrillation. And I emphasized the fact that that needs also to be taken care of because there is always the risk of blood clots throwing off into circulation. So will that cause an ischemic stroke?
Oh yes.
That is what will cause, isn't it?
If we are going to talk about the causes of strokes, that would be one of them. That would be heart diseases cause stroke, atrial fibrillation. Yes.
I think it's a good time to look at that then, isn't it?
Yes.
Shall we look at the causes then?
Yes.
Whilst we are at it.
Whilst we are still here. So the causes, it could be diet. You know how some of us love eating our salt. You know, salt is the main culprit. It raises your blood pressure, and we know that blood pressure can cause stroke. So what do we eat? Fatty food as well, you know. So we have to look after our diet, eat balanced diet. Try and minimize your fatty food, saturated food, you know, so that is the diet aspect of it. Sometimes alcohol. I know it is difficult for some people, you know, but then minimize your alcohol increase your blood pressure as well. That's right. So minimize minimize your alcohol intake as much as possible if you can, and also people who do drugs, you understand? So that is also some of the.
So by drugs you mean like recreational?
Yes, drugs. Recreational drugs as well, and sometimes even diabetes. Also, you know, diabetes, blood pressure, kidney disease, they all, you know, part of the organs that causes blood, you know, problems that can cause stroke as well. So sometimes you can have seizures. You know, with stroke, sometimes you can have seizures. You can have seizures with stroke. So look out for all these things.
Right. So with the causes, we've mentioned about recreational drugs, diabetes, hypertension, any other? Obesity, I guess.
That will place into inactivity. So exercise, especially with COVID. Nowadays we have to continue talking about COVID. We know how important it is to exercise. The more you move, the more your blood vessels get the rich oxygen, go out, you know, as much as you can. So inactivity, you sit at one place, then you get obesity. So that is when it can also cause stroke because of inactivity.
Anyway, to the viewers, Dr. Khan was meant to join us and he's still trying to get here but he's been held up due to workload and work pressures. So we are still going to keep our fingers crossed, but we will keep going with that. But we have a few people who have joined in, most of whom, those who logged in earlier on, I can't even see their names, but I know Irene, AB and Andrew Chumesi, who is a pharmacist, is watching us. But tonight, we are looking forward to answering a lot of your questions, so please do well to just keep going with the questions. That will be very, very helpful to us. But let's acknowledge a few people, and then after that, think if we've exhausted the causes, then we can move on straight into your second phase of hospital admission.
Okay, with the courses well, sometimes, as you know, there's no course.
Right.
Sometimes there's no course, nothing. You know,
those
it's just idiopathic. Yes, idiopathic.
Yeah.
They will look into everything, and then it just happened. Yes, and also some congenital problems as well. Some people were born with, you know, some congenital malformations. They call AVM. Okay. That is atrial venous malformation.
Right.
So that one can also rupture and cause a stroke. That is why stroke can happen to anybody. Baby that was born today can have a stroke all the way to old age. So anybody can have a stroke because of the vast causes.
And even the lack of oxygen, like people have conditions, especially in babies actually. When their brain gets like doesn't get enough supply of oxygen. I know it can lead to a stroke in the very young.
That's right.
As well.
The young,
right. Fantastic. So let's see who is here. Phone a friend. There are not many of you that I can see on here now. So invite your friends and let them come and listen to all this and get the knowledge, because stroke is so common. Lydia Kwashi says this is very interesting and very scary. Thanks for sharing. Kathy Mas, hope you are doing well. Good teaching, simplified. We want it to be as simplified as possible, because people need to know about this. Parmensa, hello, at what age is one at risk of a stroke? Are there any signs one should look out for? And I think we have done that even in a, anyone can have a stroke.
From babies to, old age.
Obviously, when you look at how it happens in the brain and the fact that a clot can lead you to have a stroke, and also a vessel can just sort of get engorged and rupture. That is why it cuts across all ages, isn't it? Right.
And so, also congenital reasons,
where you are born with it.
Know.
You are born with it, So Ekuya Danswa, Mami Ekuya, we've missed you today. You should have been here. Nanama, great program. Share, keep sharing. Start all your watch parties. So I think she's trying to contribute that the face changes. So obviously, if you know the person, you can tell if there's a change in the symmetry of the face. And she says, unable to move arms, can they talk? So she's trying to contribute. Nanama, I guess you are probably a nurse or somebody who knows about strokes very well. And Steve Molindra, Nanama is a host here. I don't know all my colleagues here, you know, so pardon me for that. And Steve says, this is a wonderful program. I know several people who have had strokes. It is very common, isn't it? And he says, thank you so much for the program. I'm informing others about it right now. Keep doing that. Joyce Osei is watching. And Nanama also says, too much salt can lead to that. And Harriet Apia Anderson, thanks Harriet for joining in again. Alcohol intake and all that. So Benny is saying, well done. And so many other people saying well done. Edith Asam says, is stress a cause? Stress, I guess, can lead to a stroke. Keep sharing and get people to join in. We will carry on to the hospital phase of
back to the hospital.
So we've done quite a lot technically, isn't it? So shall we go back? What happened in the second hospital, the specialist hospital?
So as I said, I reached when I was told that I've had a hemorrhage and that I'm going to have a surgery. So the doctors explained to me that it's going to be an endovascular surgery.
What does
that
is
endovascular? So in this,
endo is inside. Vascular, so they are going into the vessel.
Into the vessel. Right. So my one, they went into the groin with a catheter. You know, so catheter is inserted into one of the major vessels from the groin. The clever surgeons, they work their way through. Come into my heart.
It's the same procedure I was going to say.
Into the aorta, and then through my neck, somewhere there, into the brain, and then repair the ruptured aneurysm with coil. So that process is called endovascular surgery. So they coiled the ruptured aneurysm.
So by coiling, are they trying to seal off the end points, the bleeding points?
Yeah, so they seal it. So this catheter has a coil inside it. So they work their way through, and then when they get there, they release it, and then it just seals, the coil. And sorry to interrupt.
No, it's fine.
Yeah, so mine was this, the endovascular surgery.
Okay.
The same brain hemorrhage, depending on where it happened, you know how complicated the brain is. Yeah. So depending on where the hemorrhage happened, you may have to have a craniectomy. That is when they have to actually you have an open brain surgery, and then they go and clip it.
Okay.
Yes, so either they do endovascular where they just put a coil and seal it, or they clip it. You open your brain and then they use a clip to clip the bulging area, so that it will stop bleeding.
Do you have any idea what will lead to them choosing which type of procedure you have?
Yeah, I think it depends on where it is.
Where it is.
Yeah, when they cannot get through with the endovascular, with the coil, then they have no choice but to go and do craniectomy and then work their way and look for it. It's very technical.
Very technical. I find this, I've actually watched these procedures you are talking about, because obviously in cardiology we do that to fit a pacemaker, and I have seen at Kolebu that craniotomy surgery as well.
Kolebu, Ghana.
Kolebu in Ghana, I witnessed that, and that is a major surgery. Of course, the other one is as well, but it's amazing what the specialists can do. So what happened after that?
Okay, so the surgery went well. I was in intensive care unit. So about a day or so, I came back to the ward. So in the evening...
Before we get to the ward, how many hours from when this happened did it take for you to go for surgery? Was it on the same day?
No, the next day.
The next day?
Yes.
As soon as the next day?
Yeah, the next day, early morning. Okay. Yeah, and then I had the vascular surgery.
And on the day it happened, around what time? Do you remember what time it was?
It was 11 a.m. I always remember. It's a Saturday, 11 a.m. So every Saturday, 11 a.m., I have my time. Yes. So.
Wow. But you look amazing. You really look amazing for it. Right. So, and the next day when you had the surgery, what time was it?
It was early morning. Right. I remember I was taking about 6 o'clock or so. Yeah.
Right. So it wasn't quite 24 hours yet.
No.
Wow.
Yeah. So.
Wow. So you have the surgery. Did they tell you how long the surgery took?
I wasn't told, but I remember when I opened my eyes, it was in the evening. It was quite dark in the evening.
Okay.
Yes, and two of my nurses were beside me, Sister Vicky and Vivian. I remember I opened my eyes and I saw them. I said, then I went to sleep again. Yes, so it was evening. It was evening.
Incredible. Now, so we come to the ward.
Yes.
What happens there?
So I started having this pain at my back, my lower back.
Okay.
Excruciating pain, which was unexplainable. So I told the nurses, they came, they tried, called the doctors, gave me analgesia. It helped just a little bit. Okay. So by that time, I couldn't move any part of my body, so it was really concerning. Yeah. So this pain turned into confusion. The pain. Yes. And now turned into confusion. I became so confused,
Were you aware that you were confused?
Yeah, I can remember bits and bobs because I think I was having hallucinations. So in my own world, I was talking to somebody. I still remember. It's very strange. But till today, I remember bits and bobs of what happened. Right. I remember pulling my tubes. And the doctors...
What tubes did you have?
Cannulas, just to give me some infusions or medications, and I wouldn't let them. Yeah. So me as a nurse, I know what patients are going through. Yeah. You understand? It's not them. They don't know. They can't help it. You understand? Yeah. So we as nurses, we should have even more compassion. I know we are very compassionate, you know, but we should have more compassion, you know.
When you've been there, it's a different thing.
It's a different story.
It is an absolutely different thing. Yeah. Just so you know, I think Dr. Khan just simply couldn't make it here.
Oh.
Yeah. So he is really like backing us up. He says he's here with us technically. He's going to join in and he's going to help with questions if any come up and all that. But yeah, Dr. Khan, I think we are doing fine. She's doing amazing so far, and I think we are having an awesome session. Yeah. So you get you start getting delirious. How long did it last?
Yes. So it became so bad that I had to be taken back to ITU. So what I was told is that now I've developed something called vasospasms, and that is the side effect of brain hemorrhage and the subsequent surgery. So this is what they were trying to prevent in the first place by being given that nimodipine and all that. Okay. But unfortunately, after the surgery, I developed vasospasms. Right. And this vasospasm is spasms of the blood vessels in the brain. All the vessels now start narrowing. So I'm depleted of oxygen all over again.
Cause the delirium,
yes, I guess. That is what causes the delirium, the confusion and everything, because there's lack of oxygen, and we know what lack of oxygen into the brain causes. So that is why I was very confused. So now I had to be taken back to intensive care unit, because this has become now an emergency again, because I was basically dying all over again. You understand? Wow. So I went into ITU again. They intubated me again and gave me medications, whatever they had to do, whatever.
And that is how many hours post the surgery? Do you think? Were you on the ward for a day?
Yeah, not quite 24 hours. I think between 24 to 48 hours. Yes, because I'm just going by some things I remember and going by the dates. You understand? And what I was told, really. But it's all within 48 to 24 to 48 hours. Yeah, it was quite immediately after the surgery.
Right. So they had to intubate you again.
Yeah.
And did you have to go back to theater?
No, I didn't go back to theater. Only in ITU, just to minimize the swelling. Okay. You know, I have had encephalitis, the brain was swollen, and I've had surgery. Obviously, in and out of your brain, you will be having, you know, disturbance to the brain, swelling. So everything needs to be calmed down again. And in ITU, when you are intubated, at least give the body the chance to rest, you know, to heal itself. Yeah. And also with medications and stuff. So it's, so I was in ITU for that.
And how long were you there for that phase? ITU. How long were you in ITU for?
Yes, I think I was there for another 2 days. Okay. Yeah, for another 2 days as well. Right. And then in that period, I went into my own world again. I remember,
while you were in ITU.
I know, I was so drowsy. I remember feeling as if I was lying in a bed and being pushed in a tunnel, in a long, very long tunnel, very dark, you know. So it was like, I don't know whether it's a portal. I felt like somebody pushing me by trying to hide. It's funny now, but it's not funny. Hide me from, you know, something and pushing, trying to guide me so that we'll get to the end of the tunnel. You understand? It took a long time. But this person managed to get me to the end of the tunnel. Okay. And strangely,
that was all in your head.
That is all in my head. I was in the ITU. Yes, I was in ITU. I was, you know, intubated. I didn't know, but myself, this is what I remember.
This is what you remember.
When I was drowsy and everything. Yeah.
So you were sedated?
Yes.
And miles away? Wow.
That's it. It was really scary.
It must have been scary. Yeah. And how many days was it before they extubated you?
Yeah, I think somewhere within the 2 days, they extubated me, but then I was still drowsy. You know, in ITU, I was an ITU nurse as well.
Yeah.
In ITU, they tried.
Were you at this stage still an ITU nurse?
Okay, when I had my hemorrhage, I was an ITU nurse, but I'll come back to it, how I came out of being an ITU nurse, So they try to, you know, reduce the medications and slowly make sure your sedation rate is right, you know, for the extubation, so that gently you will be extubated and then, you know, to get better and then go back to the ward. Yes.
Right.
So within 2 days, I went back to the ward. So everything, probably they think everything was right direction, you know. So I came back to the ward. In the ward, I was still drowsy, but not too agitated like before. Yeah, initially with the vasospasm, I was so confused, agitated. But this time I knew I was drowsy, but I couldn't move any part of my body. With stroke, you can't move one side, isn't it?
Right.
But on this occasion, I couldn't move, not left or right, the whole body.
Okay.
You understand? So I felt like I was dying at some point. So
that's just how you felt.
That's how I felt. I'm just describing my feeling, my experience. You understand? So I remember there was a time I told myself, okay, I need to position myself nicely straight so that in case I die, I will be in a nice position, you know, which is scary, but I do remember, you know, all these. I can see the doctors and nurses coming there trying to communicate with me, but I wasn't communicating. I wasn't talking. At this stage, I was being washed and dressed, everything by the nurses, and my lovely colleagues, my friends and colleagues used to come there. They take turns.
Okay.
You know, Irene, Catherine, Grace, all of them.
Were you working in that very hospital?
No.
It's a different hospital.
This is this special. I was still in that specialist hospital.
Right.
Queen Square, yes.
Wow.
You know.
Anyway, let's see. Dr. Khan is now home, I guess, and he's trying to join in. He said, trying to answer some of the questions people have put on there. So he says, stress is not a direct cause, but persistent stress indirectly can result in high blood pressure, which is a risk factor for stroke. Yeah, and Abba Jacobs likes that explanation. And again, Dr. Khan is saying, amazing account from Francisca. It's an amazing. I think the patients who are coming on here do not realize the incredible nature of how they have managed, you know, like expect patients. Obviously, yours is different because in addition to that, you are now a stroke specialist, a specialist in that department as well. But he, Dr. Khan says, amazing account from you. Thanks for sharing your personal account. You see, and I think that is one thing that is beginning to overwhelm me for attempting to do a program like this. And the fact that so many patients are now preparing, you know, or getting into the frame of mind to share their experiences with people, so they can also be encouraged to say that, you know what, I can do this. You see, seeing you now and then listening to this is just astonishing, to say the least. You know, stroke usually presents with like some kind of sided weakness, you know, like some functional deficit. But seeing you now, you are back to normal function. You know, incredible. Now, let's go back to the ward. So you have recovered from ITU. You are back to the ward.
But still drowsy.
And then
couldn't move.
How were you managed at that stage?
I don't know how I was managed. All I knew is that I'm being cared for by the nurses, the therapists, my friends who would take turns to come and wash me and feed me. That's all I remember.
So by this stage, you could do nothing for yourself?
I couldn't do nothing. So I remember one day, this is the day, a friend of mine and a colleague, Anita, came to me and said, Francisca, today you are going to get up from here. You are going to walk today.
How many days was it from the day of the incident?
So at this time, I think it's about 2 weeks now. I'm talking about 2 weeks has passed.
2 weeks has passed?
Yes. Fast forward. 2 weeks has passed. And I don't think I was able to do anything. I don't remember anything. Just bits and bobs. Friends will come. they would talk to me. I think I was still a little bit confused, which is all part of the, of the signs and symptoms of, the swollen, brain. Yes, that's it. So Anita came and said, today you are going to walk. I said, oh, I can't even open my eyes. So she prayed for me.
How was it them though? Were you not seen by physios?
Yeah, that's what I'm saying. I don't even know what was being done to me. If you remember, I'm telling you, I'm still drowsy. You understand? So I remember being washed, being fed, and the therapist will come there. But of course, if you are drowsy, they cannot do anything. Right. You understand? Yeah, because you have to be alert enough. For the physiotherapist, to, walk you or move and do everything. So there are physiotherapists, speech and language therapists, occupational therapists, but it all comes in depending on how alert the patient is or how stable. But you need to be stable, in order for them to also do their job. Yeah. Right. So on that day, I just was able to sit at the edge of the bed. Anita tried to help me sit at the edge of the bed. And I remember...
And Anita has got some kind of
she's a nurse as well.
She's a nurse?
Yeah, she's a nurse, yes.
So this is one of those things we say, don't try this at home.
Don't try this at home,
It needs specialist input,
So I just sat by the edge of the bed and, I said, okay, I've done so well. Then I went back to sleep. But that was the beginning of coming out of my drowsiness, beginning of my healing and everything. Yeah. So then I started having physiotherapy. So what I was going to say is that just sitting by the edge of the bed was like I've run a marathon. The main thing is fatigue, the tiredness, the effort you have to put into just sitting is enormous. You understand? I can imagine. So I'll have the physiotherapists will come. They can just walk maybe 2 or 3 steps at a time, and it's stressful. It's tedious. You feel tired. But then what I would say to anybody who is having a stroke, who is healing and recovering, just find strength from somewhere.
Inner strength.
Yes, because you need to do this. Yeah. The more you lie down, the more there is nothing going on, the more you lose muscles, the stiffer you become, because you need to move your muscles in order to get better slowly. Because as we know, some people are bed bound, wheelchair bound, you understand? So even if the therapists always say, even if you can just lift a finger, let them do it. Yeah. Even if you can just lift just an arm, let them do it little by little. Find some inner strength, because it's not easy. It's so tiring. I think with the blood hemorrhage, the main thing is the fatigue. Right. I was so fatigued, but day by day, little by little, with the help of the physiotherapist, speech and language therapists, the speech and language therapists are there also to assess the speech, your swallowing, which is very, very important. Because when you have a stroke, sometimes the food doesn't go to the according to where it's supposed to go. It doesn't go to the esophagus and to the stomach properly. So when you swallow something, it might go into your lungs. So they have a way of assessing your swallowing so that it's safe. If it's not safe, they have things like NG tube. They have to insert tubes. Sometimes some people have to have PEG insertion. PEG is like a tube that goes into your stomach. So after being fed NG, nasogastric lift, into the stomach for a long time, if you are not healing, then the best way is to go the PEG side, because you might catch infection and things like that.
So I think you are quickly going through sort of how you were managing from that stage, and you've mentioned a few sort of interventions like an NG tube. Did you have any of these things?
No, I didn't.
What did you have?
So when I wasn't eating and drinking, I had IV fluids. Going on. Because mind you, the speech and language therapist can only assess you when you are alert enough. You understand? And and with the confusion as well, sometimes you need the rest. So I was having IV fluid. So this was just few days. So I think it was okay. Yeah. Yes. Then when I was being fed. So I could eat. When they assessed me, it was okay. So I could eat. but just not physically do it myself. So yes, so I was being fed.
Okay.
Yes.
Right.
So
yeah. How long did you take from day one to getting back home?
Home, yes. So after 2 weeks, as I said, then I knew I was getting better and better. I was able to walk few distances and back. So now, you know, there is a specialist unit. You need to move on for somebody also to be admitted. Yes. But I think I was well enough to be discharged home. This is after 3 weeks.
Okay.
So after 3 weeks, I had gained all my functions.
Really?
Already, but the fatigueness of it, I couldn't walk far. I could walk like maybe 5 steps at a time or 10, you know, and that's all I could do. But I was discharged home.
Right.
Yes, but some people will have to be discharged to or transferred, I would say to acute stroke unit. So these hospitals are hyper-acute stroke units where they do the interventions.
And that's where you've been for like the
3 weeks. So I was lucky, I was discharged home. But sometimes when you need more interventions, you get discharged to acute stroke units. Sometimes from there, you still need more intervention. You go to neurological rehabilitation. So it can take as long as a month, 2 months, or even 6 months, you know, to a year, you know, in different rehabilitations. It all depends how it happens, how soon you were taken to the hospital for interventions, which is very, very important. The fast we talk about. So the faster you get to the hospital, early interventions, earlier you get your functions back, and how large the stroke was, because some strokes are really large, so you lose a lot of function, so you recover slowly. The recovery can take even years. You understand? And some people, unfortunately, don't recover at all, and we might say some people die as a result as well.
Even
as grim as
it
is, yes, some people still die.
Wow, an astonishing story. I'm so amazed. You see, a lot of us relate or think about stroke as you end up with some kind of functional deficit. End of story.
No.
Is that the case?
No, that's not the case. You need to work hard with your therapist. You know, I know some people refuse treatment. Is their, you know, is their right, but you need to work with your therapist. As I said, there's speech and language therapist, physiotherapist, and occupational therapist. When I came home, I was looked after by my family because I don't think they thought I would need all that. I would need
following the assessment in hospital.
Yes, yeah, I was able to walk. You know, I was able to walk
unaided,
with the aid of one person, which my family could do it. You understand? I was able to talk.
So you didn't, I'll keep asking, interrupting. Did you have any walking aids?
No, I didn't have any walking aid.
No walking aid
after discharge. No. But
Really?
in the hospital, yes, there was a time I was using wheelchair because I couldn't go that far. You understand? So I was using wheelchair. Yeah, and if you remember, I was bedbound. I couldn't move any part of my body. Yeah, but by the 3rd week, I was able to regain all functions and then, you know, started walking slowly, you know, yes.
Amazing.
Yes.
I'm so happy. Yeah, if not for anything at all, like you are a living testimony. And I think it's the same for a lot of the patients who have come here so far. And that is why my favorite part of all this is the patient account, hands down, you know, because even for us as health professionals, like, seeing the recovery part of it, we'd hardly see what happens eventually after discharge, isn't it? We are used to seeing things from the acute certain point of view, but the aftercare, especially at home, of course, if you are a home care nurse and stuff, you will probably see that aspect of it. But from the acute phase to your recovery at home, I think it's the very big gap, isn't it? That has to be filled. So you've gone home without any walking aids.
Yes.
Were you eating and drinking normally?
I was eating and drinking normally.
Right.
Yeah, but I couldn't do anything. I couldn't dress myself. All because of fatigue. You understand? Mine was fatigue. My problem was fatigue. It affects everybody differently. Mine was fatigue. I couldn't dress myself. I couldn't wash myself completely. But my daughter, my family, my husband, everybody was there to help me. You understand? So all these assessments are done. Sometimes they say family help. So my family helped me. Sometimes other people, they go home with package of care. Package of care where you will have carers to come and wash you, dress you, sometimes cook for you, depending on, you know, your family circumstances and how weak or, you know, functional you are when you are going home.
Okay.
Yeah, so you have carers coming. Sometimes you have therapists coming home. There are some weeks window where they come and help you, set you up, you know, help you maybe shopping, the carers, to adapt to your environment when you are discharged. But my one, as I said, was the fatigue. So it took a long time. It took months and months, at least 6 to 8 months before I was able to go back to work.
Wow.
You know, so going back to work, it was a phased return to work.
We will go into that. But let's see what other questions we have on here.
Okay.
And like I discussed with you, stroke is such a massive topic. And people need to know how to manage the stroke patient. And I am thrilled that you are in the best position to do that, because today you are a patient giving an account of what you experienced. But we have another session where I plan to get you here, so we take all the systems like how to help the patient, because you know it's not all countries that have the kind of facilities that we have here. So there are a number of viewers, or so many of our viewers on this show, watching from countries like Ghana or more or less privileged, should I say, countries. So how we'll manage will be in another session. If you don't mind, because I don't see how we are going to squeeze everything into just one session. It's almost impossible, but it is very important we do that. So let's see them, because there are a few more questions here. Gladys Commodore is watching. Hi, Lydia Kwashi. I think Lydia is hosting watch parties. Guys, share, start watch parties, invite your friends and keep sharing. Liking our page. It's all coming to you by courtesy of Omega Live TV, Omega House Multimedia, with kind sponsorship of World Remit. World Remit, the safest way to send money to your friends and family back home. I've been using their services just over the weekend, so I know it is perfect. It's really, really good. Dr. Khan says stroke is the 4th most common single cause of death in the UK, the 4th. So it is a very common condition. An estimated more than 100,000 people get their first stroke in the UK each year. Wow, that's a huge number of people. We should not take this for granted. Guys, we cannot possibly take this for granted. Omega Live TV viewers, Dr. Robert Khan is online to answer your questions. So do well to keep this show interactive as possible. And that is from my honorable producer. He must be happy, you know, because it's going really well. My producer and Dr. Khan, of course. And Dr. Khan also said that I think someone is asking a question saying, how much movement do you need in order not to be too little or too much exercise after suffering? You get the question?
I do.
What is much?
I can answer that.
And let me take a few more. So just get ready with that. And Lydia Kwashi, you know Lydia Kwashi, isn't it? Yeah, she's saying, I know Francisca Ameyaw, a colleague who is sharing her experience in stroke. I think she's trying to answer somebody's question. She's a big fan of this show. She's always, like you, of course, always following. And let's take this again from Dr. Khan. Note the following as well: sudden loss of or blurring of vision, confusion, difficulty understanding what others are saying, problems with balance and coordination, sudden severe blinding headache, sometimes with neck pain and stiffness could be symptoms of impending stroke. And I think you did highlight that. And then in the UK, we are blessed with interventions, and about 85% of stroke patients survive to be discharged from hospital. The situation is different in most countries, you've said, with no resources. Key message: if you have symptoms, seek medical attention quickly. Prevention is always better than cure. Oh, my big sister just woke up from her sleep. Poor me. You are late, big sis. Anyway, thank you all of you for joining in. Angela Nana Otu is watching. Angela, Jenny Otu. I think that's Jenny Otu, President, Western Regional Association of Nurses. And Vianyo Chega says, does age matter when it comes to recovering from a stroke? So there are two questions for you to answer, isn't it? Stroke, and then how much exercise is too much exercise. Shall we take those and then we progress? We've done an hour,
Is it?
Well over an hour. So if you take on these two questions, how much is too much exercise?
So always listen to your body.
Key message.
That is the best answer I can give you, because your body will tell you that you've had enough. After stroke, you need to rest. A lot of rest is also very important to healing. Water. I would say water is life. Drink water, water.
I had the kidney patient, Mr. Jaja. Hello, Mr. Jaja. I'm sure you're watching. And he emphasized that.
Yes.
Drinking all these
clear water.
Just water.
Not juice. I'm not talking about malt. I'm not talking about any fizzy drink. Water. So listen to your body. When you, like I said, I could do only 2 steps and it will feel like I've had a marathon, like 100-meter race. So for me, my 2-step was enough at that particular time. But it builds. It gets better by the day, you understand? And then you drink water, you sleep, and then you do it all over again. But if the therapist, you can't do it yourself and it's only the therapist doing it, they know. They know when you are tired and when it's too much. And always they don't do too much anyway. 20 minutes, 30 minutes normally is enough. But it's important to keep moving, keep stretching. Even if you're on your own, keep stretching, keep something in your hands. Otherwise it goes, those who have had it really severe, your hand can really clench, so keep moving, put the ball there, you understand, massage it with oil, keep moving, your hand, whatever, keep moving, so do something.
Does it go to the carers as well, isn't it?
Yes.
To do it for them. Like we have passive exercises.
I don't think the carers are allowed to do,
they are not?
I'm not sure what the carers do, but I will talk on behalf of the therapist. So at home, the therapist will come for a few hours, and for a few weeks. But then again, you also have to probably employ maybe private. Private therapists, it depends, you understand, because sometimes it takes time. It may even take months, years, because stroke is vast. Stroke is vast.
To those who have had some kind of loss of function, say of a limb, where, like as you are saying, massaging and trying to get some activity into their body. Obviously, I can imagine the carers being, because we are looking at the UK setting where things are ideal, isn't it? Can they not also do the exercises with them?
Probably the passive one, maybe the hand, a little bit, because you have to be trained to know what you are doing. So I don't want to say that the carers,
absolutely,
are allowed to do that.
That makes sense, because obviously everything we say here has to be backed by evidence, and we have specialists, and so we will not go into that. So let's see. Age matters, Dr. Khan says. The older you are, the worse the prognosis could be. And so now Big Sister is awake. She says, to what extent does regular massages help a person's physique before or after a stroke? So bear that in mind. And then, did we answer the question? We've answered about age, isn't it?
Dr. Khan has
answered that. And then Irene AB says, being sedated and ventilated on a ventilator in ITU could have been a contributory factor to the tiredness. We know that causes that as well, isn't it? Okay. So now you are at home recovering. How long did it take for you to do anything unaided?
Unaided? Without help. It took about 3 months. It took about 3 months because I was just resting. Every little effort I make is really tiring. So even though you look at me, I'm okay, I'll be sitting there. You will come and visit me and then I will sleep. I have visitors, and when I'm tired, I'm tired. That's what I'm saying. Your body will tell you the question, your body will tell you when you are tired. And I remember just leaving my visitors and I would sleep. I'll drink water and sleep. And then my husband would just talk to them. They would understand that, I'm tired. But at the 3rd month, started getting better. I started being able to go out. I remember my daughter would take me out. I'll hold her hand. And this happened in November.
And were you walking?
So, yes. This happened in November. The stroke happened in November. That particular year, there was a lot of snow. So December, I'm talking about December, January. And I was so determined that I want to walk. So I would just do a little walk just in front of my house, and then my daughter would just hold my hand, and then we come out of the house. It was such a big deal. I was so happy that I've been able to come out of the house, but there was snow on the floor. I was really scared, but I knew I had to do it. And when I'm having headaches, so this one brings headaches. It brought me headache. You understand? Fresh air is also a big thing. We are blessed, those of us who have a garden, so I'll go and sit in my garden for some fresh air. It relieves the headaches, and then I feel good when I just sit in the fresh air. But unfortunately, not everybody will have a garden to sit, you understand? But you can go out, have a little walk with somebody, obviously, if you can't, and every movement helps. Don't give up. Just keep moving. Find some inner strength, If you are religious, pray and find some strength. If you are not, whatever gives you strength, find an inner strength from somewhere, from something, and keep going. Because depression is another thing.
It's another complication.
You can get so depressed that you just want to sleep. You don't want to see the daylight. Sometimes, you understand. But that's what I'm saying. Find the strength from something, from somewhere. You understand? Because you seeing yourself how you were, what you could do, and now maybe there's loss of limb, there's loss of function, you are wheelchair bound, you are bed bound, but keep going. Every movement that you can do helps. Yes.
Right. So I think we'll try and round off this session shortly, because we really, How much time have we got? 20 minutes.
Oh, okay.
So we do have time. Guys, we have time. We've been given 20 more minutes, which is a lot we can get in. Let's look at you personally, like what you were doing before the stroke, what you were doing after the stroke. And let's try and find me. And then we will wait for more people to bring on questions. We will take them one after the other. But what were you doing before? I mean, obviously you are a nurse, but were you an ITU nurse at that stage?
Yes. So at that point, I was an ITU nurse. So as I said, I went back 8 months after. But we go to occupational health because you need to be assessed again, isn't it, whether you can go back to your normal duties. So occupational health, with the help of my manager at the time, Sister Vicky, and then my matron, Monica, they were fantastic, So they helped me. I had to move into, outpatient department. I was looking after sickle cell patient, and that was great. So I started with 3 hours at a time. But that's all I could manage. And it was tiring. And I'm talking about 8 months later. So 3 hours, and then I could build it slowly to 4 hours, and then 6 hours a day. It gets better, water. Even as I'm talking now, I have my days that I have the headache, So after the surgery, going back after the surgery, after discharge, I started with MRI scans every 3 months, and then 6 months, and then yearly. And then I've just been discharged, basically, just last year been discharged. And it's been 8 years now.
Really?
Yes, because they have to check on me, review whether the coiling they did is still in place, and that there's no rebleeding or there's no other aneurysms, trying to, you know, develop again.
Yeah.
You understand? So, so there is all this procedure that you still have to do. Yeah, so slowly I then was able to do full time. But then I said, okay, I enjoy working on the wards.
Yeah.
So I went back to the wards. And then I saw an advertisement, stroke nurse, you know, looking for...
Before we go into that, you try to describe some kind of psychological effect of being in ITU. You were an ITU nurse, but the psychological impact it had on you.
Yeah.
The thought of just going back to ITU. Can you describe that? Because I found that very...
Yeah, so there were two things, actually. The fatigueness, that I couldn't really take ITU anymore. At the time anymore. But the next thing was that, obviously, when I went back to work, I went into ITU, isn't it? Doing few hours before I was, you know, looked after and had a different ward outpatient setting. Yeah. So I'll go into ITU, and then I'll be looking at the patient, and I see myself. You understand? I think it's post-traumatic. Yeah. You know, it was so emotional that I would look at the patient and I would see myself lying there as if it's me, and I knew I can't do ITU anymore. So there were two things. The reason why I had to leave, you know, unfortunately, that was the fatigue bit and the fact that it's traumatic for me, post-traumatic, looking after ITU patients again was too emotional. I was putting myself there. And yes, so that is why.
Your decision to come here and share this with everyone, it is so brave. Like any of the other patients who have come here so far, I'm personally proud for other reasons because you were my mate and you've been amazing.
Thank you.
Group O, we are great.
Mini
meeting. You have been awesome. You know, in sharing, even though you were so scared, and I said, look, have you shared this story anywhere before?
This is a different platform. I've shared my story at church before, about 2 platforms I have. You know, there was different Christian groups that I've shared my story before. And I'm looking forward to sharing it, you know, to help people, you know, especially to know that it will be okay. Because I remember when I went to see my occupational health about 2 or 3 months after discharge, the occupational health doctor was trying to encourage me that I will be okay. I can come back to work one day. And I didn't want to believe him. Because the effort just to come even to sit in front of him to have the session, just the appointment was such a big deal. So I just want to encourage people that it will be okay. You will be okay. Give it time. With time, with God on your side, you know, God willing, you will heal. You know, because you can go into depression and you know everything will go the other way. But keep going, find some strength. You know, that is what is motivating me to, you know, share my story. You know, God is good. You get better.
You get better.
Yes.
Awesome.
Yeah.
Awesome stuff. Yeah. You see, what all this brings to me is that sometimes we simply don't know what people are going through until you get closer enough to them. And I find myself so privileged at the moment, just purely based on the kind of things people are sharing with me through this program. And I am so encouraged to keep going because obviously from the stories, then the feedbacks, all the feedback keep coming in, and people wanting to know more and more and all the questions. So this will not be the beginning of it. And obviously this platform will always be open if you want to share more stories. So let's see. Catherine Boche says she is proud of you.
Oh,
I am even more proud, Kate. You have no idea. Irene is saying, AB says, supporting with the phased return to work is when the specialist occupational health professional, obviously she is a specialist occupational health therapist. Hi, Sister Irene. She's been here before. And Dr. Khan says, massage. He's trying to answer AC Hammond's question, which says, do we massage and all that? And he says massage improves muscle tone and circulation, so can enhance well-being. Yeah, but do it gently though, gently. yeah, not to break bones, because
but
honestly,
with the stroke patient, that is paramount. You need to do it.
To do it, but like gently, isn't it?
Gently,
yeah. Because oh my God, some people when they give you massage, you can't really feel it.
No.
Yeah, and Jenny Otu again says, very proud of you, Mrs. Ameyaw, and we thank God for your recovery. Amazing. We thank God so much for your recovery. There is a question from Jenny again who says, Dr. Khan, a friend had a stroke and her speech was affected as well as her memory.
That's right.
She did not have any other disability. So what type of stroke did she have? Would we know? I think this one will go. What do you want the question again? Like the speech and
I get the question.
Memory.
Any type of stroke can cause speech impairment and memory function. It all depends. It all depends on how large the stroke is and where it happened. You understand? So unfortunately, some stroke present itself like that. And as I said, some people don't recover. You understand? And some people recover fully like me. But unfortunately, some people don't get their speech function back. Yes.
Yeah, wow. Right. Okay. Let's see if there are any more questions. There is another answer from Dr. Khan. Remember that mini stroke, that's the TIAs, can present with recurrent episodes of tingling or numbness. Because I think AC Hammond was asking about tingling and numbness. So he says it can present with recurrent episodes of tingling or numbness, especially of the face and limbs. Do not ignore persistent tingling and numbness, even if it is not stroke. It could be some other neurological condition. So that is the advice from Dr. Khan. Eunice Esel says, thanks so much for another insightful session. Eunice, are you trying to finish the show for us tonight? Sister Eunice, thanks for watching. If you haven't or you have just joined in, there has been so much that has been discussed already. Tonight we have been looking into, I think once the time goes on and people finish work and more start joining in. Now the numbers are going up, they start joining in, but unfortunately, I don't know whether to move the time to later on in the evening.
Especially our times of finishing work.
Because more and more people, I'll look into that, but it's because I travel, so sometimes it's like 7:30 is just fine, but we will do something about it, because if more people can catch up later, I'm sure we can do something about the time. And I'm sure a lot of my hosts will also, my guests will also love probably to come in a little bit later. So we will look into that. So thank you guys so much. Irene says, I think the recovery could depend on the extent of stroke. That's what you've said, and how quickly you get the interventions
right.
for.
Very important.
So we will wait for a few more questions. But like I said, if you want to catch up on any of the sessions that we've done so far, just go to the pages of Omega Live TV on Facebook and YouTube. You can send me a message. If you are not my friend, you can still definitely contact me through Messenger, and I can send you, because there are groups now who asking if you want me to even give you sessions. I've started Zoom sessions and all that, so it's getting better and better all the time. So who knows where we can take this. Is there anything you want to say? So we round off. If you can sort of summarize the day's program.
Let me finish. I think I still haven't finished. Just 3 minutes.
No. We have time.
Okay.
I didn't want us to exhaust, because we want to put another session in. But make it relevant. Say everything you want us to say. Say it, because we've been given the time.
So what I wanted to say is that going back to work. Even till now, the fatigue is still sometimes there. I'm doing full time. But then I take regular breaks. I take regular breaks. I drink a lot, and I listen to my body, because sometimes.
So by a lot, how many mils of water are we talking about?
Oh, if you are able to do 2 liters, that's fine. But
I can't believe someone is calling me
1.5. Yeah, right? 1.5 is okay. But please, water.
Okay.
So I listen to my body. In my ward, we have 2 breaks. So I normally takes the first break, but my manager knows.
Yeah.
So she tends to give me the first break, and then I drink a lot of water. Sometimes I still feel the headache. I know it's here. I know exactly where it is. I can trace it down my neck. There have been times that I can trace the pain from my groin, all the way through where the surgery happened. I know I can trace it. So when that kind of pain is coming, I know. I drink water, you understand? And then I sit in my car, close my eye. During my break time, I try and rest. I try and sleep. Yeah, about an hour break, I try and sleep 20 minutes, 30 minutes, and then I gather myself, and then I go back. Because I don't know whether it will be lifelong, but I'm managing it. You understand? I try my best.
Amazing.
Yeah, I don't let it get me down too much. Yeah. It's scary. Sometimes you feel like, what is happening? You understand? You are a human being.
Yeah.
You still, so try. Eat well, calm down. As I'm saying, it can happen to anyone.
Yeah.
And also, you could be born with something that you don't know. So try and keep your stress levels down, your blood pressure down. If you are on any medication, please take your medication. That's also very important. Yeah, very important, because some of us don't want to take our medication, isn't it? I know somebody who had a stroke because the doctor had identified she is hypertensive. Take medication. She decided to take it every other day because, my blood pressure. But you never know what a particular day, what your blood pressure is going to do. So if the doctor says take it every day, don't make your own times. Take it every day. You understand? Which, because to some people, at least something is giving you a warning. I didn't get any warning. I didn't have any blood pressure. I'm not diabetic. I have no underlying causes. Yeah, but then I did have, hemorrhagic stroke. So if you are lucky enough to be told that this and this is what you have, I know it's not easy, but you try your best, eat well, exercise, drink a lot of water, and then pray as if it all belongs to God.
That's my punchline.
That's right.
Pray as if it all depends on God. Now, I will quickly acknowledge a few people, and then, it's been amazing. I'm so glad we are coming back to do this. So we take the different systems,
because we haven't had the time. Anything yet.
It is almost impossible to look at how to care for the stroke patient. So that will
be rehabilitation. Those who have really had it bad.
So we will do that in another session, guys. Keep sharing. Georgina Santi says you've done so well. You've done so well, and I think a lot of people will agree with her on that. Abba Jacobs, who is caring for your children at this time? Of course, her husband is at home, Abba.
They are big now.
They are not babies anymore. They are big now. Yeah. What an amazing story. Yeah, you were so scared coming to do this, but obviously I do understand, but I knew you will smash it.
You did. You said that.
I said that. Of course. I am confident, because the patients, one thing patients are good in this country for is managing themselves, and that is why we are trying to get this program to everyone to learn how to manage themselves. It encourages me as well, because whatever I'm doing at home, I'm thinking, you said this on the show, what are you doing?
Yes.
It is challenging me so much to the max. And, it's incredible. So we will be doing the next session in a month's time. Okay. Yeah. But before we sign off, in 2 weeks' time, I'll have Mr. Jaja. Those who have been following this program religiously, Mr. Jaja is a kidney patient who came on. And again, we were going to have another session because we didn't have the chance to look at the psychological impact, how he has managed to adapt into the society and all that. We did not look into that. And hooray, this program is nearly a year old.
Wow.
Yeah, and he will come, and then we will have that session where you come and show us about stroke. And like I said in the last session, I really need us to do something, not just host a show and just talk without having an impact on any place at all. So like I mentioned in the last show, I plan to at least, just because of my specialty, just to see if we can get a few raise funds, get a few cardiac monitors, ECG machines, all those form basic investigations, isn't it, for anybody who is acutely ill. If you are from the Western region especially, and if you are a big fan of this show, I cannot emphasize enough the importance of having some of these gadgets. We've got to start from somewhere.
Yeah.
And so I think I want us to start from where I have the links. And I thought, which better place to start than Effiang Kwanta Hospital, for instance? And I want this to happen. So I cannot do this on my own. Obviously, my family can't do it on our own. So I will need everyone's help. I mean, how cool will it be if we go to, say, a unit in Effiang Kwanta and we have ECG machines and we have nurses who can read. You know, the way we are trained here, you are not just trained to perform the ECG, but you can interpret and take action so that at the end of the day we can save lives. So Mr. Jaja will be here in 2 weeks' time, but in the meantime we are rounding off. All this has come to you by kind courtesy of Omega Life TV and by sponsorship of World Remit. We have been looking at stroke, and it was a survivor story. But the amazing thing is she is a nurse as well, and she will be coming, a stroke nurse actually, and she will be coming our way in a month's time to look at how we can manage our stroke patients. I am your host, I'm Mrs. Winnie Ohene-Kissi, and I have thoroughly enjoyed the session. So Francisca, once again, I say a very big thank you to you. Dr. Khan, you couldn't make it, but as usual, you are solidly behind me, and I cannot ever thank you enough for the support you give to me in doing this show. So to all of you who have been watching, please keep sharing, so we get to all people. Listen to the account again, start your watch parties, and try and stay safe, because as you know, regardless of where you are anywhere in the world, COVID is still catching people out. So until we come your way again in 2 weeks with another episode of Let's Talk About Health, it's your host Winnie, and I'm saying bye, stay safe.